Hello, my name is Stephen Firkins from The Ohio State University, and I'll be discussing my project, Incidence and Predictors of New Onset Diabetes Mellitus Following Surgical Resection of Pancreatic Cystic Lesions. I have here just a general overview slide of my poster, and we'll be discussing each section individually to come. New onset diabetes mellitus is common following partial pancreatectomy, with an estimated pooled prevalence of 21% following distal and 16% following proximal pancreatectomy. Pancreatic cystic lesions, or PCLs, are increasingly diagnosed with advances in cross-sectional imaging, and unlike other indications for partial pancreatectomy, may have relatively normal surrounding pancreatic tissue. Yet to date, there have been no studies evaluating the incidence and risk factors of new onset diabetes following resection of PCLs. We utilize the IBM MarketScan research database, which is one of the largest publicly available databases containing inpatient and outpatient claims-based data to identify patients who had undergone partial pancreatectomy for PCLs without any prior pancreatic disease or prevalent diabetes mellitus, and completed a retrospective cohort analysis to identify the incidence and risk factors of new onset diabetes mellitus following surgery. Kaplan-Meier analysis revealed a 15.1 and 20.2% incidence of new onset diabetes at 12 and 24 months respectively, which is similar to the incidence following pancreatectomy for all indications. Following univariable analysis, multivariable Cox proportional hazards model revealed that increasing age, obesity, hypertension, and cardiovascular and heart disease were independent predictors of new onset diabetes mellitus, with the caveat that MarketScan does not contain data from Medicare claims, thus the data from the older than 65 years age group is not entirely generalizable. Finally, we conducted a secondary analysis identifying the incidence following distal versus proximal pancreatectomy, and in our data set, significant difference was not achieved for the incidence of new onset diabetes mellitus following distal versus proximal resection. In conclusion, we have successfully identified the incidence as well as risk factors of new onset diabetes mellitus in patients who underwent partial pancreatectomy for PCLs with otherwise normal preoperative pancreatic tissue. Those at increased risk of new onset diabetes may benefit from peri and postoperative monitoring, education, and treatment strategies for diabetes, and may be considered for a growing number of non-surgical interventions for PCLs. Thank you.